I'm Dr. Amy Wilson. I'm a pediatric nephrologist with IU Health Physicians in Riley Children's Hospital. I've been in practice since 2010. So when I was in medical school, I decided to become a pediatrician because frankly, I loved working with the children on the pediatric services, both in the course of my medical school rotations and as a volunteer on some of the playroom units. As I worked through my residency, I discovered a real love for pediatric nephrology, which is the study of kidney diseases and high blood pressure, because it gave me the opportunity to care for children in so many different arenas. Everything from caring for the sickest of the sick children in the ICUs who might need emergency dialysis or long-term dialysis support for kidney failure, to being able to build long-term, really rich relationships with patients and their families in an outpatient clinic. So when a child comes to see me for the first time, they can expect to meet actually a lot of people besides just me. Depending on what your child is coming to see me in consultation for, you might meet with not just me to get a sense of the full rich history of your child's medical condition, but also potentially to meet with a dietitian if your child has significant kidney disease and we need to rethink how their diet impacts their medical care. They might meet with a social worker if your child's condition has significant impacts on their school attendance or school performance. You might meet with some of our trainees. Part of being a doctor in an academic hospital is working with pediatric residents, pediatric nephrology fellows, to teach them all of the things that I do in my day-to-day role. So you might meet with several doctors and not just me. And you can probably expect that your child will need some additional testing and lab work, and that we might not get to a final answer that first day. But what you can know is that I'll continue to work with you until we come to that answer. The things I love about my job are really several. One is that I love being able to watch kids go from really truly critically ill in the hospital to well and thriving and back in school at home with their family and their friends. It's such a reward to see a kid who came in with a really truly life-threatening illness literally run into my clinic and give me a high five. That's pretty amazing. I also love the opportunity that my job has given me to interact with our patients in less formal settings. I serve as the camp doctor for our kidney camp each year. So the kids out there know me as Dr. Amy, wearing shorts and a t-shirt and trying hard to keep up with them through all of their activities. It's hard, but I also love being able to help families through the really hard times and sitting with them through some really hard conversations about choices around dialysis and whether we're going to do dialysis at home or here in the outpatient unit 3 times a week. Those are really challenging times, but I love coaching families through that. Outside of the hospital and the clinics, I am a mom to 2 great children. So my chief hat outside of here is mom, which means kid shuttler and cheering section, choir performances and cross-country meets and soccer games, and the list goes on and on. We also love to travel as a family, and we're currently on a quest to try to get to all of the national parks.